My name is Aloyce Urassa. I'm a public health scientist based in Tanzania. I'm currently the chair of the African Leaders Malaria Alliance Youth Advisory Council, and I also serve at the board of Rotarians Against Malaria Global. In the Kilimanjaro region, which is the northern part of Tanzania in the highlands, there was very little to no transmission of malaria and almost heading to zero transmissions or almost going there. But recently, there have been cases being reported from having local transmissions and severe malaria cases being reported in different hospitals. And looking at this, it comes very strangely, and there is really lack of data to bring the connection between the rising temperatures. For instance, in the region currently, we used to have temperatures ranging from 16 to 25 degrees centigrade, but now it goes up to 31, most of the days 31 and above, making it very warm, and these will be temperatures suitable to allow more mosquitoes to breed. From the southern parts of the country where floods have been happening, immediately after the floods, there's a lot of swampy areas which remains with stagnant water and allowing breeding of more mosquitoes. You'll hear from the members of the communities telling you how the frequency of mosquito bites have increased. The coastal communities are people who have their traditions of even sitting outside for a long time in the evening, but now they would even fear to sit for longer evening because of the increased frequency of mosquito bites. And all these mosquito bites are attributed not only to malaria, but also even other diseases. We need data, we need information, we need the scientific background to explain, but also it becomes sometimes easy because things are evident. For instance, when you talk of El Nino, it is something that the leaders can see themselves that this time is warmer compared to the other time. Like in the last 2 years, we expected to have rainfalls between, for instance, between March and April, but we did not have this. It never rained. And then it came to rain in June when we did not expect it, and it rained heavily, leaving a lot of other impacts behind, including flooding, which have distracted the housing, have distracted the infrastructure, including roads, making it difficult for them to access healthcare services. All these heavy rains came in a very unpredicted time, in a time that the community, the government was not prepared. So we need to do more to adapt or mitigate these impacts of climate change, which are really coming up. So trying to communicate in an easy language that people can really see the interaction between, and then they can easily give the support and even amplify the voices to reach more leaders to bring about political will in addressing the nexus between climate change and malaria. There's insufficient data, so researchers within the countries are embarking into research studies that will bring more information and more data to justify the nexus between climate change and malaria, because without data, it's really difficult to even communicate about malaria and climate change. For myself, as a researcher, I'm also currently doing my master's thesis around looking at stakeholders' perspective on how stakeholders perceive the preparedness state of the country when addressing the nexus between climate change and health. Other initiatives that are happening, national malaria control programs and partners are already coming up with different approaches, and like the past approaches where they could just maybe distribute and educate the communities about mosquito nets. But now they're coming up with more approaches that will include community health volunteers to educate others to understand the interaction between the environment and their health, the interaction between environment and the mosquitoes, the breedings, like the breeding sites, what makes them favorable. Why do they exist more in this community than in the other community?